The death toll is 24. About 60 people are still in the hospital tonight recovering from injuries suffered when the tornado hit. Through all of this part of Oklahoma, Dr. David Hogan is an emergency room physician who helped treat many of the 90 patients who were rushed into the hospital last night. Doctor, you're an emergency room physician. You
Yes.
were in the emergency room when the tornado hit.
That's right.
What did it look like, sound like, feel like when the patients started coming in?
There were quite a number of people covered with mud, sand, almost as if they'd been sandblasted, which is typical for what you see with tornadoes. We saw quite a few people with regard to serious head injuries and bone fractures. It was pretty much chaos.
Quite a few children were hurt in the two schools that we've talked about this
That's
evening.
true. That's true. We fortunately saw only 5 children at our particular institution, and they were all able to be sent home.
And the most difficult injuries that you saw were what?
The most difficult ones for us were head injuries. Those needed to go directly to the operating room, and in fact, one of the people that we had expire was a serious head injury.
And tell me about some of the other injuries of the people who are still in the hospital tonight. Typically, what kinds of things are they suffering from?
Those sorts of things are usually fractures of the arms, fractures of the legs. Many of those are open with the bones exposed, which seriously complicates their treatment. And just numerous soft tissue wounds, complex lacerations, everything, as you can imagine, covered with mud and contaminated.
You know, I wonder, with all of the debris in the roadways, how did these people get to the hospital?
That's interesting you should ask that. A number of them show up in the back of pickup trucks and private vehicles, police cars. We weren't close enough for too many of them to be able to walk to us, but that has happened before. And in addition, of course, the ambulances bring these patients in.
And the patients who were treated and then released, what kind of shape are they in?
Most of them are going to be okay. A lot of it with those folks will not be so much the physical injury, but the emotional shock that's associated with any kind of devastation like this.
There's post-traumatic stress.
Absolutely.
That has to be treated in the years to come.
Absolutely.
Doctor, thank you so much. Appreciate
Thank you.
you being with us, and thank you for all the work that you did for these people.
Thank you very much.
Thank you.